Good day everyone. My name is Dr. Dirk Kukumur and I'm going to explain to you how to use the conditioning page. You will get to the conditioning page whenever you do a TTA test, a tone threshold or geometric test. This is a page where you will train the patient how to press the button on the response button. It's very important to train a patient to press a button well, because if the patient can press a button very well, the test will go quicker, whether you're doing automatic or a manual test, and you will record excellent response statistics. The response statistics are standard deviations and response times, but I will explain a little bit more about how this works in the final test when we look at the report. On the conditioning page, you've got multiple buttons. On the left hand side and the top you will see here, you've got blue, that's a left side, showing you how loud the tone will be presented in the patient's ear. And on the right side, the red side, you also see the same loudness. The tones for conditioning are always 1000 Hertz. It's important to use the conditioning page and not the test page to condition the patient, because you don't want to put lots of incorrect data on the test page. So it's better to do the conditioning here. You will see there's a button where you can present a tone at 80 dBs in this case, and on the right side you can present a tone at 60 dBs. This is not a test page. This is not where you're going to test the patient. It's just to condition the patient. There's also a way to mask. This is where you play a masking sound in the patient's ear to train the patient to ignore the masking sound and only listen to the presented tones. Here you will see the automatic wait time. This is in automatic mode. This is how long the software will wait for the patient to press the button. Here you can also see left and right. This is where you decide whether you want to start in the left ear, start in the right ear, after you ask the patient whether he can hear the best in the left or the right ear. Here right to the bottom you will see there's a talk button with few controls next to it. So whenever you start to do a test, you will not put the KUDUwave onto the patient's head before you get to this page. Typically you will not do it. There are exceptions. So whenever you're going to test the patient, you will get to this screen. You will press the talk button. What the talk button means, the microphone on the outside of the ear cup will pick up your voice and play it through the tube, through the ear tip into the patient's ear. So the benefit with this is when you put the KUDUwave on the patient's head at this stage, the patient will hear you all the time. And the patient actually doesn't realize there's something on his head because he can hear you. The only time he realizes, oh, he's now in the simulated sound booth, is when you press the talk button and it goes quiet. And the patient sometimes will look around, what just happened? So I'm going to keep the talk button in just to explain to you a little bit more here. If the patient's got a slight hearing loss, you might decide to actually increase the loudness. They're too loud. Then you can talk to the patient and he can hear you better. It's maybe not a bad idea to actually take the history on the patient with hearing loss on this screen, because you actually create an artificial amplification hearing aid for the patient while you take the history. Then there's other options also. This is where Talk KUDUwave is a standard talking forward principle, but you can also have talk booth. Talk booth is when the KUDUwave is inside the sound booth and you've got the cable going into the booth and you're sitting outside with your laptop. Now what talk booth does is the microphone on your computer will pick up your voice and play it into the patient's ear. The microphone on the KUDUwave inside the booth will pick up the patient's voice and play it onto the speakers of your computer. If you've got a headset plugged into your PC, you will hear the patient's voice on the headset. This is also the typical screen where you will put the KUDUwave on the patient's head. So after I've put the KUDUwave on the patient's head, I will train the patient how to press the response button, and I will typically say, here's the button, hold it in your hand, keep your finger on the button. The moment you hear a beep sound, press the button quickly and let go. I will then also typically say beep and see if the patient presses the button. When I feel comfortable the patient has got a good idea what to do, I'll tell the patient it's going to go quiet now, and then I press this button and then it goes quiet. I will then move to present a tone in the ear at 60 dBs, and I will wait for the patient to press the button. There you can see the button wasn't pressed. So what I will do, if the patient didn't press the button, I might press the talk button, explain to the patient again how to press the button, press talk again, and then I'm going to try again. Beep. And I press the button. Pressed a bit too slow for automatic wait time. So I have to train this patient to press the button fast enough. I'll try again. That's better. Try again. That's better. So my rule of thumb is you need 3 greens in a row before you can press next here at the right bottom to continue and do an automated or manual test. But before we click next, let me just explain one more thing for you. If you want to train the patient to ignore the masking sound, I will click on talk. I'll tell the patient you will hear a noise in your ear. If you hear that noise, ignore it. But in between the noise, you will hear tones. I'm going to present the masking sound in your ear now and press the button when you hear a tone. We'll switch off talk. Switch on masking at 60 dBs in the right ear, and I will present the tone. And there the patient pressed the button. I'll try again. I'm happy. So I can switch off masking now. I know this patient is conditioned, and when I later on have to do masking, especially in bone conduction, this patient will know what to do. If that patient is a very slow button presser, cannot press that button within 2.5 seconds, you can increase it to 3 seconds. Most people actually can press a button much faster. You can decrease it to 1500 milliseconds. That's 1.5 seconds. But the golden one is run by 2.5 seconds. Then you know most patients will press the button in time. I will now go over to the testing page where I will click next here, and then the test will automatically start.